Question 1. The investigation demonstrates that a manufacturing process for critical medical devices is experiencing an increase in minor surface blemishes. The quality engineering team is tasked with implementing a statistical process control (SPC) charting strategy to monitor and control this issue. They are considering several approaches for charting the number of blemishes per device. Which of the following approaches best aligns with the principles of effective SPC implementation and regulatory expectations for process control in a highly regulated industry? Option A. Utilizing an X-bar and R chart to monitor the average number of blemishes per device and the range of blemishes within each sample. Option B. Applying an NP chart to track the number of non-conforming devices in samples of a fixed size, where non-conformance is defined by the presence of any blemishes. Option C. Employing a P chart to monitor the proportion of non-conforming devices, where a device is considered non-conforming if it has more than a specified number of blemishes. Option D. Implementing a C chart to track the total number of blemishes observed across all inspected devices in a given time period, assuming the inspection area or sample size is consistent. Correct answer is D. Implementing a C chart to track the total number of blemishes observed across all inspected devices in a given time period, assuming the inspection area or sample size is consistent. Explanation. The investigation demonstrates a common challenge in implementing statistical process control (SPC) within a regulated environment, balancing the need for rigorous data analysis with the practical constraints of operational deployment and regulatory compliance. The professional challenge lies in selecting the most appropriate SPC chart type for a given process characteristic, ensuring that the chosen chart effectively monitors process stability and signals potential deviations that could impact product quality and safety, thereby adhering to regulatory expectations for process control. Careful judgment is required to avoid misapplication of SPC tools, which could lead to ineffective process management, increased risk of nonconformance, and potential regulatory scrutiny. The correct approach involves selecting an SPC chart that accurately reflects the nature of the data being collected and the specific process characteristic being monitored. For attributes data such as the presence or absence of a defect, charts like P, NP, C, or U are appropriate. The choice among these depends on whether the sample size is constant, NP, C, or variable P, U, and whether the count of defects is absolute C, or normalized by sample size U. For variables data, such as measurements of a physical dimension or time, X-bar and R or X-bar and S charts are suitable. The X-bar chart monitors the process average, while the R chart monitors process variability using the range, and the S chart monitors variability using the standard deviation, which is generally preferred for larger sample sizes. The regulatory framework for a certified reliability engineer typically emphasizes the use of validated and appropriate statistical methods to ensure product quality and safety. Implementing SPC charts that are correctly matched to the data type and process objective directly supports these regulatory requirements by providing a systematic and statistically sound method for process monitoring and control. An incorrect approach would be to use an X-bar and R chart for attribute data, such as the number of non-conforming units in a batch. This is a regulatory and ethical failure because attribute data does not follow a normal distribution, which is an assumption for X-bar and R charts. Using such a chart would lead to incorrect control limits and potentially false alarms or missed signals of process instability, undermining the purpose of SPC and failing to meet the regulatory expectation of using appropriate statistical methods. Another incorrect approach would be to use a P-chart when the sample size is constant and the focus is on the number of non-conforming units. While a P-chart can be used, an NP chart is more direct and efficient in this specific scenario, as it plots the actual number of non-conforming units rather than the proportion. This is a failure in professional practice by not selecting the most efficient and appropriate tool, which could lead to less clear interpretation of the data and potentially slower response to process shifts, indirectly impacting the ability to maintain regulatory compliance. A third incorrect approach would be to use a C chart when the sample size varies. A C chart is designed for a constant sample size and counts the number of nonconformities. If the sample size varies, the control limits would be incorrect, leading to an unreliable assessment of process stability. This is a significant regulatory and ethical failure, as it renders the SBC chart invalid for its intended purpose, potentially allowing non-conforming products to enter the market and violating the principle of robust process control mandated by regulatory bodies. The professional decision-making process for similar situations should involve a thorough understanding of the process characteristic being measured, the type of data generated, variables or attributes, and the specific requirements of the relevant regulatory framework. This includes identifying the underlying statistical distribution of the data. Once these are understood, the engineer should consult established SBC methodologies and guidelines to select the chart that best fits the data and the monitoring objective. Validation of the chosen chart and its implementation is crucial. An ongoing review of its effectiveness in maintaining process control and meeting quality standards is essential for sustained regulatory compliance. Question 2. The analysis reveals that a failure mode's effects and criticality analysis, FMECA, for critical medical device has identified several potential failure modes. One mode, though identified as having a high severity of potential harm, has a low predicted occurrence rate. Another mode has a moderate severity but a very high predicted occurrence rate. A third mode has both high severity and a moderate predicted occurrence rate. Given limited resources for immediate corrective actions, which approach best aligns with regulatory expectations for ensuring patient safety? Option A. Prioritize immediate corrective actions for the failure mode with both high severity and a moderate predicted occurrence rate, as this represents the most significant overall risk. Option B. Focus initial corrective actions on the failure mode with a low predicted occurrence rate but high severity, as the potential harm is the most critical factor. Option C. Implement corrective actions for the failure mode with a high predicted occurrence rate, regardless of its moderate severity, to reduce the overall number of potential failures. Option D. Address the failure mode with the highest predicted occurrence rate first, as this is the most likely to impact patients in the short term. The correct answer is A. Prioritize immediate corrective actions for the failure mode with both high severity and a moderate predicted occurrence rate, as this represents the most significant overall risk. Explanation. Scenario analysis. This scenario presents a common challenge in reliability engineering, where a FMECA identifies potential failure modes with significant safety implications. The professional challenge lies in balancing the urgency of addressing high-risk items with resource constraints and the need for a systematic, data-driven approach. Misinterpreting or misapplying FMECA findings can lead to either unnecessary expenditure on low-impact issues or, more critically, a failure to adequately mitigate severe safety risks, potentially violating regulatory mandates and ethical obligations. Correct approach analysis. The correct approach involves prioritizing corrective actions based on the criticality assessment derived from the FMECA. This means focusing resources on failure modes with the highest risk scores, typically a combination of severity and likelihood. This aligns with regulatory frameworks that mandate risk-based decision-making for safety-critical systems. For instance, in the U.S., agencies like the FAA for aviation or FDA for medical devices require a systematic approach to identifying and mitigating hazards, with a strong emphasis on addressing the most severe risks first. Ethically, engineers have a duty to protect public safety, which is best served by a prioritized, risk-informed mitigation strategy. Incorrect approaches analysis. Implementing corrective actions solely based on the perceived ease of implementation ignores the criticality assessment and could lead to resources being diverted from high-risk issues. This violates the principle of risk-based prioritization, mandated by most safety regulations, and is ethically questionable as it may not adequately protect public safety. Addressing only the failure modes that have occurred in the past, without considering the potential for future, more severe failures identified in the FMECA, is a reactive rather than a proactive approach. Regulations often require a forward-looking hazard analysis, and this approach fails to meet that standard, potentially leaving the system vulnerable to new or unexperienced critical failures. Focusing exclusively on failure modes with the highest frequency of occurrence, without considering their severity, can lead to misallocation of resources. A frequent but low-severity failure might consume resources that could be better used to prevent a rare but catastrophic failure, thereby failing to meet the overarching safety objectives required by regulations and ethical standards. Professional reasoning. Professionals should approach FMECA findings by first understanding the criticality ranking. The decision-making process should involve a clear hierarchy. Highest severity and likelihood failures are addressed first. This requires a robust understanding of the FMECA methodology, including how risk scores are calculated and interpreted. When resource constraints exist, the focus must remain on the highest risk items, potentially involving trade-off analyses and justification for any deferral of lower priority actions. Collaboration with management and other stakeholders is crucial to secure necessary resources or to communicate the risks associated with delayed mitigation. Question 3. Compliance review shows that the reliability assessment for a new safety-critical electronic component relies on a simplified statistical model. The engineering team has chosen to use a uniform distribution to represent the component's time to failure, citing its simplicity in calculation. However, preliminary failure analysis suggests that the component is subject to wear-out mechanisms, meaning its failure rate is likely to increase over its operational life. Which of the following approaches best aligns with regulatory expectations for reliability engineering in this context? Option A. Conduct a qualitative risk assessment to identify potential failure modes, and if no critical failures are identified, the current reliability assessment using the uniform distribution is deemed sufficient. Option B. Increase the safety factor applied to the results obtained from the uniform distribution to compensate for the potential underestimation of risk due to wear-out. Option C. Reevaluate the choice of probability distribution to one that accurately models wear-out phenomena, such as the Weibull distribution, and use this to perform the reliability analysis, ensuring the results meet specified regulatory failure rate thresholds. Option D. Proceed with the uniform distribution analysis as it is a standard statistical model, and the regulatory framework does not explicitly prohibit its use for time-to-failure modeling. The correct answer is C. Reevaluate the choice of probability distribution to one that accurately models wear-out phenomena, such as the Weibull distribution, and use this to perform the reliability analysis, ensuring the results meet specified regulatory failure rate thresholds. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a reliability engineer to interpret and apply probability theory in a context where regulatory compliance is paramount. The challenge lies in moving beyond theoretical understanding to practical implementation that meets stringent standards, particularly when dealing with potential safety-critical systems. Misinterpreting or misapplying probability distributions can lead to inadequate risk assessments, incorrect design choices, and ultimately, non-compliance with regulations designed to ensure product reliability and safety. The engineer must balance technical accuracy with the specific requirements of the regulatory framework. Correct approach analysis. The correct approach involves selecting a probability distribution that accurately models the failure behavior of the component based on empirical data and expert judgment, and then using this distribution to perform a reliability analysis that directly addresses the regulatory requirements for acceptable failure rates or confidence levels. This is the best professional practice because it grounds the reliability assessment in a statistically sound model that is appropriate for the observed or expected failure modes. Regulatory frameworks often specify acceptable reliability metrics, e.g., mean time between failures (MTBF), probability of failure within a certain time frame, that are derived from these distributions. Using an appropriate distribution ensures that the calculated reliability metrics are meaningful and defensible under regulatory scrutiny. For example, if a component's failure rate is known to increase over time, wear out. Using an exponential distribution, which assumes a constant failure rate, would be inappropriate and could lead to underestimation of risk, violating the spirit and letter of regulations that mandate robust safety margins. Incorrect approach is analysis. An approach that relies solely on historical data without considering the underlying failure mechanisms or the specific requirements of the regulatory framework is flawed. This fails to account for potential changes in operating conditions, manufacturing processes, or design modifications that could alter the component's failure distribution. It also risks misinterpreting data if the historical data itself is not representative or if the chosen metric, e.g., average failure rate, doesn't capture the critical aspects of reliability demanded by regulations. Another incorrect approach would be to select a distribution based on ease of calculation or familiarity, without validating its suitability for the specific component and its failure modes. This disregards the fundamental principle of statistical modeling, which requires the model to accurately reflect the phenomenon being studied. Regulatory bodies expect a scientifically justified approach, not one based on convenience. If the chosen distribution does not align with the actual failure characteristics, the resulting reliability predictions will be inaccurate, potentially leading to noncompliance with safety or performance standards. A third incorrect approach might involve using a distribution that is overly conservative to the point of being impractical or economically unfeasible, without a clear regulatory mandate for such extreme conservatism. While conservatism is often a desirable trait in reliability engineering, an unjustified level of conservatism can lead to overdesign, increased costs, and potentially hinder innovation, without a corresponding demonstrable increase in safety or compliance beyond what is required. The goal is to meet regulatory requirements effectively, not to exceed them arbitrarily. Professional reasoning. Professionals should adopt a systematic approach that begins with understanding the regulatory context and the specific reliability requirements. This involves gathering all available data, understanding the physics of failure for the component, and then selecting the most appropriate probability distribution that best fits the data and the failure modes. The chosen distribution should then be used to calculate reliability metrics that directly address the regulatory compliance criteria. If there is uncertainty, consulting with subject matter experts and performing sensitivity analyses are crucial steps. The decision-making process should prioritize data-driven justification and alignment with regulatory expectations to ensure both technical integrity and legal compliance. Question 4. To address the challenge of accurately predicting product lifespan and potential warranty costs for a new line of electronic components that have undergone extensive testing and exhibit a consistent rate of failure after an initial burn-in period, which statistical distribution is the most appropriate to model their reliability, and why? Option A. The log-normal distribution, as it is suitable for modeling failures that occur due to multiplicative effects in the system. Option B. The exponential distribution, as it accurately models systems with a constant failure rate which is characteristic of these components post-burn-in. Option C. The normal distribution, because the failure times when plotted appear to cluster around a central value. Option D. The Weibull distribution, due to its flexibility in modeling various failure rate patterns, including wear-out. The correct answer is B. The exponential distribution, as it accurately models systems with a constant failure rate, which is characteristic of these components post-burn-in. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a reliability engineer to select the most appropriate statistical distribution for analyzing product failure data. The choice of distribution directly impacts the accuracy of reliability predictions, warranty cost estimations, and maintenance scheduling. Misapplication of a distribution can lead to significant financial losses, customer dissatisfaction, and potential regulatory noncompliance if safety-critical systems are involved. The challenge lies in understanding the underlying failure mechanisms and matching them to the theoretical properties of different distributions, all while adhering to industry best practices and potential regulatory guidance for reliability reporting. Correct approach analysis. The correct approach involves selecting the exponential distribution when there is strong evidence that the failure rate is constant over time. This is often the case for electronic components after an initial infant mortality period and before significant wear-out occurs, or for systems with random, external causes of failure. The exponential distribution's key characteristic of a constant hazard rate aligns with a scenario where the probability of failure in any given time interval is independent of how long the product has already been operating. This aligns with the fundamental principles of reliability engineering, which emphasize modeling failure behavior accurately based on observed data and known physics of failure. Regulatory bodies often expect reliability data to be presented using distributions that are theoretically sound and demonstrably fit the observed data, ensuring transparency and defensibility of reliability claims. Incorrect approaches analysis. Selecting the Weibull distribution when the failure rate is known to be constant is an incorrect approach. While the Weibull distribution is highly versatile and can model increasing, decreasing, or constant failure rates, its primary strength lies in its ability to capture wear-out phenomena, increasing failure rate, or early life failures, decreasing failure rate. Using it for a constant failure rate scenario introduces unnecessary complexity and can obscure the simplicity and direct interpretability of the exponential distribution, potentially leading to less precise or misleading reliability estimates if not carefully parameterized. This could be seen as a failure to apply the most appropriate and parsimonious model, which is a hallmark of sound engineering practice. Choosing the normal distribution when the failure data is skewed and does not exhibit a bell-shaped pattern is also incorrect. The normal distribution assumes symmetry around the mean and is best suited for phenomena that are the sum of many independent random variables, central limit theorem. Product failures, especially those related to wear or degradation, are often not normally distributed. They tend to be right-skewed, meaning there's a long tail of products failing much later than the average. Applying a normal distribution in such cases would lead to inaccurate predictions of failure times, particularly for the upper quantiles of the distribution, which are critical for understanding long-term reliability and product lifespan. This misapplication can lead to underestimation of potential failures and associated risks. Opting for the log-normal distribution when the failure data exhibits a constant failure rate is incorrect. The log-normal distribution is appropriate when the logarithm of the failure times is normally distributed, which often occurs when the failure mechanism involves multiplicative effects or when the failure rate is increasing. If the failure rate is constant, the log-normal distribution is not the theoretically sound choice. Its application in this context would imply a failure mechanism that is not present, leading to an inaccurate representation of the product's reliability characteristics and potentially flawed predictions. Professional reasoning. Professionals should approach the selection of statistical distributions by first understanding the physical mechanisms of failure. This involves analyzing historical failure data, considering the product's operating environment, and consulting any available physics of failure models. The next step is to evaluate the hazard rate behavior implied by the data and the failure mechanisms. If the hazard rate appears constant, the exponential distribution is a strong candidate. If it appears to be increasing or decreasing, or if the data is skewed, Weibull, log-normal, or other distributions might be more appropriate. It is crucial to perform goodness of fit tests to statistically validate the chosen distribution against the observed data. This systematic, data-driven, and theoretically grounded approach ensures that reliability predictions are accurate, defensible, and meet professional and regulatory expectations. Question 5. The review process indicates that a reliability block diagram, RBD, has been developed for a critical system. As the certified reliability engineer, what is the most appropriate approach to assess the impact of individual component reliability on the overall system's probability of success? Option A. Visually inspect the RBD and subjectively estimate which components appear most critical to the system's overall reliability. Option B. Perform a quick estimation by assuming all components contribute equally to system failure, regardless of their position in the RBD. Option C. Conduct a sensitivity analysis by systematically varying the reliability of each component and observing the resulting change in system reliability, documenting the findings based on the RBD structure. Option D. Focus solely on the number of blocks in series within the RBD, assuming these are the primary drivers of system failure. The correct answer is C. Conduct a sensitivity analysis by systematically varying the reliability of each component and observing the resulting change in system reliability, documenting the findings based on the RBD structure. Explanation. This scenario presents a professional challenge because it requires a certified reliability engineer to interpret and apply the principles of reliability block diagrams, RBD, within the context of the ASQ Certified Reliability Engineer body of knowledge, specifically focusing on the impact assessment of system reliability. The challenge lies in moving beyond simple RBD construction to understanding how changes in component reliability affect the overall system, and how to communicate these impacts effectively and ethically. The engineer must ensure their assessment is grounded in sound engineering principles and aligns with the professional standards expected of a CRE. The correct approach involves a systematic evaluation of how variations in the reliability of individual components, as represented in the RBD, propagate to affect the overall system reliability. This requires understanding the structure of the RBD series, parallel, or complex configurations, and applying appropriate methods to quantify the impact of component reliability changes on the system's probability of success or failure. This aligns with the ASQ-CRE's expectation of applying reliability tools for system analysis and decision-making, ensuring that the assessment is technically sound and supports informed decisions regarding design improvements, maintenance strategies, or risk mitigation. The ethical imperative is to provide an accurate and unbiased assessment of reliability impacts, avoiding oversimplification or misrepresentation that could lead to poor engineering choices or compromise safety. An incorrect approach would be to solely focus on the visual representation of the RBD without performing a quantitative or qualitative impact assessment. This fails to meet the core requirement of understanding how component reliability influences system reliability. Another incorrect approach would be to make subjective judgments about the impact without a structured analysis, which lacks the rigor expected of a CRE and can lead to inaccurate conclusions. Finally, an approach that prioritizes speed over accuracy by making broad assumptions about component impacts without detailed analysis would also be professionally unacceptable, as it risks misleading stakeholders and compromising the integrity of the reliability assessment. Professionals should approach such situations by first understanding the specific system architecture as depicted by the RBD. Then, they should identify the critical components whose reliability significantly influences the overall system reliability. This is followed by a structured impact assessment, which could involve sensitivity analysis or other quantitative methods to determine how changes in individual component reliability affect system reliability. The findings should then be clearly communicated, highlighting the key drivers of system reliability and the potential consequences of changes in component performance. This systematic, data-driven, and transparent process ensures that the assessment is both technically robust and ethically sound. Question 6. What factors determine the appropriate level of detail and scope for a fault tree analysis (FTA) when assessing the reliability of a complex industrial control system, considering both potential failure modes and operational context? Option A. The personal experience of the lead reliability engineer and the number of components in the system. Option B. The ease of identifying individual component failure modes and the time available for the analysis. Option C. The criticality of the system's function, the availability of historical failure data, and the potential consequences of system failure. Option D. The preference of the system's end users for a simplified or detailed report. The correct answer is C. The criticality of the system's function, the availability of historical failure data, and the potential consequences of system failure. Explanation. This scenario is professionally challenging because the reliability engineer must balance the need for thoroughness in fault tree analysis, FTA, with the practical constraints of project timelines and resource allocation. The core of the challenge lies in identifying and prioritizing the most critical failure modes that could lead to the top event, ensuring that the analysis is both comprehensive and actionable without becoming an exhaustive, unmanageable exercise. Careful judgment is required to distinguish between minor contributing factors and significant root causes that warrant detailed investigation and mitigation. The correct approach involves a systematic identification of basic events and their logical interrelationships that contribute to the undesired top event, followed by a qualitative assessment of the fault tree to understand the failure mechanisms. This is then typically followed by a quantitative analysis, if data is available, to rank the importance of different failure modes and identify the most probable or impactful combinations leading to the top event. This aligns with the principles of risk management and system safety engineering, which are foundational to reliability engineering. Specifically, within the context of standards like those referenced by the Certified Reliability Engineer exam, such as those derived from ISO or industry-specific best practices, the emphasis is on a structured, evidence-based approach to identifying and mitigating risks. The regulatory framework implicitly requires a proactive and systematic method to ensure product or system safety and reliability, which FTA directly supports by providing a clear visual and analytical representation of failure pathways. An incorrect approach that focuses solely on identifying every conceivable minor contributing factor without regard to their probability or impact would lead to an overly complex and unwieldy FTA. This fails to meet the professional obligation to provide a focused and actionable analysis. Such an approach would be ethically questionable, as it diverts resources from addressing more significant risks potentially leaving the system vulnerable to critical failures. It also fails to adhere to the spirit of regulatory requirements that mandate effective risk management, not just exhaustive documentation. Another incorrect approach that relies on subjective judgment and intuition, without a structured methodology for identifying basic events, and their logical gates would be professionally unacceptable. This lacks the rigor and objectivity expected in reliability engineering. It is ethically problematic because it introduces bias and increases the likelihood of overlooking critical failure paths, thereby compromising system safety and reliability. Regulatory bodies expect a defensible and repeatable process, which subjective approaches cannot provide. A third incorrect approach that prioritizes identifying only those failure modes that have been encountered in past, similar systems, without considering novel failure mechanisms or unique operational contexts, is also flawed. While historical data is valuable, it is not exhaustive. This approach risks overlooking new or emergent failure modes that could arise due to design changes, new operating environments, or unforeseen interactions. Ethically, this demonstrates a lack of due diligence in ensuring the reliability of the current system. Regulatory frameworks often require consideration of potential failures beyond historical precedent to ensure robust safety and reliability. The professional decision-making process for similar situations should involve a clear understanding of the system's objectives and potential hazards. The engineer should define the top event clearly, then systematically decompose it into contributing events using a structured methodology. Prioritization should be based on a combination of event probability and consequence, guided by available data and expert judgment. The goal is to create an FTA that is both technically sound and practically useful for risk reduction and decision-making, ensuring compliance with professional standards and regulatory expectations. Question 7. The risk matrix shows a high probability of failure for a critical component within the first year of operation, with a severe consequence if failure occurs. Considering the certified reliability engineer's ethical and professional obligations, which of the following approaches best addresses this situation? Option A. Implement a statistically sound reliability demonstration test designed to specifically expose and quantify the high-risk failure modes identified, providing objective evidence of the component's reliability under simulated operational stress. Option B. Postpone comprehensive reliability testing until after the initial production run, citing current budget limitations and the need to meet market launch deadlines. Option C. Conduct a series of qualitative failure mode and effects analyses, FME, without accompanying physical testing to validate the identified risks. Option D. Proceed with a limited, accelerated life test focusing on general wear-out mechanisms, assuming that historical data from similar components will adequately cover the specific high-risk failure modes. The correct answer is A. Implement a statistically sound reliability demonstration test designed to specifically expose and quantify the high-risk failure modes identified, providing objective evidence of the component's reliability under simulated operational stress. Explanation: the risk matrix shows a high probability of failure for a critical component within the first year of operation, with a severe consequence if failure occurs. This scenario is professionally challenging because it pits the immediate cost and time pressures of implementing robust reliability testing against the long-term risks of product failure, potential safety hazards, and reputational damage. The certified reliability engineer, CRE, must balance these competing demands while adhering to established professional standards and any applicable regulatory frameworks. The decision requires a deep understanding of reliability principles and the potential impact of inadequate testing. The correct approach involves prioritizing a comprehensive reliability demonstration test that directly addresses the high-risk failure modes identified. This approach is right because it aligns with the core principles of reliability engineering, which mandate proactive identification and mitigation of risks. Specifically, it ensures that the product's reliability is statistically demonstrated under conditions that simulate its intended use, providing confidence that it will meet performance requirements. This proactive stance is ethically sound, as it prioritizes user safety and product integrity over short-term cost savings. While specific U.S. regulations might not mandate particular reliability test types for all products, the ethical and professional obligation of a CRE, as often guided by professional bodies like ASQ, American Society for Quality, is to ensure products are fit for purpose and safe. This includes conducting appropriate testing to demonstrate that fitness. An incorrect approach would be to proceed with a minimal or accelerated life test that does not adequately cover the identified high-risk failure modes. This is professionally unacceptable because it fails to provide sufficient evidence of reliability for a critical component with severe consequences. It represents a disregard for the identified risks and a potential violation of the CRE's duty to ensure product quality and safety. Another incorrect approach would be to rely solely on historical data from similar, but not identical, products without specific validation for the current design. This is flawed because subtle design changes or manufacturing variations can significantly impact reliability, and historical data may not be representative. This approach risks overlooking new failure mechanisms. A further incorrect approach would be to postpone comprehensive testing until after initial production, citing budget constraints. This is ethically and professionally problematic as it knowingly exposes users to risk and can lead to much higher costs associated with recalls, warranty claims, and damage to the company's reputation. The professional decision-making process for similar situations should involve a systematic risk assessment, followed by the selection of appropriate reliability engineering tools and techniques. This includes clearly defining the reliability objectives, identifying potential failure modes, and selecting testing methodologies that provide statistically valid data to demonstrate that these objectives are met. The CRE must advocate for the necessary resources to conduct adequate testing, clearly communicating the risks of insufficient testing to stakeholders. This involves a commitment to ethical practice, prioritizing safety and product integrity, and adhering to the highest professional standards. Question 8. Cost-benefit analysis shows that further investment in reliability growth for the aging avionics system could significantly reduce in-flight failures, but the system is nearing its planned obsolescence date. Given the certified reliability engineer's responsibility to ensure product safety and economic viability, which approach best balances these competing factors? Option A. Halt all further reliability growth efforts immediately due to the system's age and impending obsolescence, focusing resources on the next generation system. Option B. Focus solely on the historical average failure rate of the system, ignoring the impact of recent design modifications to estimate future reliability. Option C. Continue investing in reliability growth using a CRO-AMSA model to project future reliability and associated cost savings, and then make a data-driven decision on further investment based on the projected return on investment relative to the remaining operational life and strategic goals. Option D. Implement all proposed reliability improvements without further analysis, assuming that any increase in reliability is always beneficial regardless of cost or system lifecycle. The correct answer is A. Halt all further reliability growth efforts immediately due to the system's age and impending obsolescence, focusing resources on the next generation system. Explanation. Scenario analysis. This scenario presents a common challenge in reliability engineering where a product is nearing its end of life or a critical upgrade is planned. The challenge lies in balancing the investment in further reliability improvements against the diminishing returns and the impending obsolescence or replacement of the system. The decision-maker must consider not only the technical feasibility of further growth, but also the economic justification and the alignment with strategic business objectives. This requires a nuanced understanding of reliability growth models and their practical application beyond mere theoretical prediction. Correct approach analysis. The correct approach involves utilizing a reliability growth model such as CRO-AMSA to project the future reliability of the system based on the observed failure data and implemented corrective actions. This projection is then used to estimate the cost of achieving a target reliability level and compare it against the projected benefits e.g., reduced warranty costs, improved customer satisfaction, extended operational life. The decision to invest further in reliability growth is then made based on this cost-benefit analysis, ensuring that the investment is justified and aligns with the product's lifecycle stage and business strategy. This aligns with the principles of sound engineering practice and responsible resource allocation, which are implicitly expected in professional engineering contexts. Incorrect approach is analysis. One incorrect approach is to discontinue all reliability improvement efforts solely because the system is aging. While aging is a factor, it does not automatically negate the potential for further growth, especially if the system is still critical and has a remaining useful life. This approach fails to consider that even older systems can benefit from targeted improvements, potentially extending their operational viability and delaying costly replacements. It also ignores the potential for significant cost savings through reduced failures. Another incorrect approach is to continue investing in reliability improvements indefinitely, regardless of diminishing returns or the system's lifecycle stage. This can lead to wasteful expenditure, where the cost of achieving marginal reliability gains outweighs the benefits. It demonstrates a lack of strategic thinking and an inability to make pragmatic decisions based on economic realities and product lifecycle management. A third incorrect approach is to rely solely on historical reliability data without considering the impact of implemented design changes or corrective actions. Reliability growth models are specifically designed to account for these improvements. Ignoring this aspect means the projections will be inaccurate, leading to potentially flawed investment decisions. This approach fails to leverage the predictive power of established reliability growth methodologies. Professional reasoning. Professionals in reliability engineering must adopt a data-driven and strategic approach. When faced with decisions about continued reliability investment, the process should involve 1. Understanding the product lifecycle and strategic business objectives. 2. Applying appropriate reliability growth models, e.g., CRO-AMSA, to analyze current performance and project future reliability based on implemented changes. 3. Conducting a thorough cost-benefit analysis that quantifies the projected costs of further improvements against the expected benefits. 4. Making a decision that is technically sound, economically justifiable, and aligned with the overall business strategy. 5. Documenting the rationale for the decision, including the data and models used for future reference and accountability. Question 9. The control framework reveals that a regression analysis has been performed to assess the impact of manufacturing process parameters on the failure rate of a critical component. The analysis indicates a statistically significant relationship between two parameters and the failure rate. However, the engineer is unsure how to proceed with recommending design modifications based on these findings. Which of the following approaches best reflects a responsible and compliant decision-making process for a certified reliability engineer? Option A. Conduct a thorough review of the regression model's assumptions and diagnostics. Assess the practical significance of the identified relationships in the context of product performance and safety, and consult with subject matter experts before making any recommendations. Option B. Immediately recommend design modifications based solely on the p-values indicating statistical significance, without further investigation into model assumptions or practical implications. Option C. Recommend design modifications based on the statistical significance of the identified relationships, assuming the model's assumptions were met and the effect size is practically relevant. Option D. Dismiss the findings due to a lack of immediate intuitive understanding of the relationships, and proceed with the current design without further investigation. Correct answer is C. Recommend design modifications based on the statistical significance of the identified relationships, assuming the model's assumptions were met and the effect size is practically relevant. Explanation. This scenario presents a professional challenge because it requires a reliability engineer to interpret the results of a regression analysis and make a critical decision about product design modifications based on that interpretation. The challenge lies in ensuring that the interpretation is not only statistically sound, but also aligns with the regulatory expectations for product safety and reliability, particularly when dealing with potential risks. A deep understanding of the underlying assumptions and limitations of regression analysis is paramount to avoid misinterpretation that could lead to inadequate safety measures or unnecessary design changes. The correct approach involves a thorough examination of the regression model's assumptions and diagnostics, alongside a critical evaluation of the practical significance of the identified relationships. This means verifying that the residuals are normally distributed, have constant variance, and are independent, and that the independent variables are not highly collinear. Furthermore, it requires assessing whether the magnitude of the effect indicated by the regression coefficients, even if statistically significant, translates to a meaningful impact on product reliability or safety within the operational context. This aligns with regulatory frameworks that mandate a data-driven, yet practically grounded, approach to risk assessment and mitigation. For instance, in a U.S. context, regulatory bodies like the FDA or CPSC expect evidence-based decisions that demonstrably reduce risk to consumers, which necessitates understanding the real-world implications of statistical findings, not just their p-values. An incorrect approach would be to solely rely on statistical significance, e.g., p-values below a certain threshold, without scrutinizing the model's assumptions or the practical implications of the findings. This failure is regulatory because it bypasses the requirement for robust validation of the analytical methods used. If the model's assumptions are violated, the statistical significance may be misleading, leading to incorrect conclusions about the relationship between variables and potentially flawed design decisions. Ethically, it is a failure to exercise due diligence in ensuring product safety. Another incorrect approach would be to overemphasize the predictive power of the model without considering the potential for extrapolation beyond the observed data range. This is a regulatory failure because it can lead to decisions based on unreliable predictions, potentially underestimating or overestimating risks. Ethically, it represents a lack of professional responsibility in ensuring that decisions are based on sound scientific principles and within the bounds of the data's applicability. A third incorrect approach would be to dismiss statistically significant findings due to a lack of immediate intuitive understanding, without further investigation into the underlying mechanisms or consulting with subject matter experts. This is a professional failure because it can lead to overlooking genuine reliability issues that might not be immediately obvious, but are statistically supported. It also fails to meet the expectation of a thorough and objective analysis of all available data, which is often implicitly or explicitly required by regulatory oversight. The professional decision-making process for similar situations should involve a multi-step approach. First, clearly define the objective of the regression analysis and the specific reliability questions to be answered. Second, select appropriate variables and ensure data quality. Third, build and validate the regression model, paying close attention to assumption checking and diagnostic analysis. Fourth, interpret the results in the context of practical significance and the operational environment. Fifth, consider the limitations of the model and the potential for extrapolation. Finally, document the entire process, including the rationale for decisions made, to ensure transparency and accountability, especially when regulatory compliance is a factor. Question 10. Market research demonstrates a growing demand for faster product development cycles, leading a senior executive to propose a significant reduction in the number of reliability tests performed on new product designs to accelerate time to market and reduce costs. As a certified reliability engineer, what is the most appropriate approach to address this proposal? Option A. Implement the reduction in testing and focus on marketing efforts to highlight the product's perceived speed to market rather than its tested reliability. Option B. Immediately implement the proposed reduction in testing to meet the executive's demand for speed and cost savings, assuming the product will likely perform adequately. Option C. Conduct a comprehensive risk assessment to evaluate the potential impact of reduced testing on product reliability, safety, and compliance with relevant standards, and present findings to management with recommendations. Option D. Agree to the reduction in testing based on the executive's directive, and then attempt to find data later to support the decision. The correct answer is C. Conduct a comprehensive risk assessment to evaluate the potential impact of reduced testing on product reliability, safety, and compliance with relevant standards, and present findings to management with recommendations. Explanation. This scenario presents a common challenge in quality management where a perceived shortcut, driven by external pressures, conflicts with fundamental quality principles and regulatory expectations. The professional challenge lies in balancing the immediate demand for cost reduction with the long-term imperative of maintaining product reliability and customer trust, all while adhering to established quality management frameworks. Careful judgment is required to identify and resist pressures that could compromise the integrity of the reliability engineering process. The correct approach involves a systematic and data-driven evaluation of the proposed change. This means thoroughly assessing the potential impact of reducing the number of reliability tests on the overall confidence in the product's performance and safety. It requires engaging relevant stakeholders, including design, manufacturing, and quality assurance teams to understand the risks associated with fewer tests. Crucially, it necessitates referencing established reliability engineering standards and best practices, which emphasize sufficient testing to demonstrate compliance and identify potential failure modes. The ethical justification for this approach stems from the responsibility to ensure product safety and efficacy, as mandated by general principles of professional engineering conduct, and in many regulated industries, specific legal and regulatory requirements that demand robust product validation. An incorrect approach would be to immediately agree to the reduction in testing without a proper risk assessment. This failure is ethically problematic because it prioritizes cost savings over product reliability and potentially customer safety, violating the engineer's duty of care. It also represents a regulatory failure if the reduced testing falls below the minimum requirements stipulated by industry-specific regulations or standards that the company must adhere to. Another incorrect approach is to implement the reduction based solely on the opinion of a senior manager, without independent verification or analysis. This demonstrates a lack of professional integrity and a failure to uphold the principles of objective decision-making in quality management. It subordinates technical judgment to managerial authority, which can lead to significant risks if the manager's assessment is flawed or influenced by non-technical considerations. This approach also risks violating regulatory requirements that mandate independent quality assurance functions and evidence-based decision-making. A third incorrect approach is to implement the reduction and then attempt to retroactively justify it with post hoc analysis or by downplaying the significance of potential failure modes. This is a deceptive practice that undermines the credibility of the reliability engineering function and violates the principle of transparency in quality reporting. It also fails to meet regulatory expectations for proactive risk management and robust validation processes. The professional reasoning process for similar situations should involve 1. Clearly understanding the request and its potential implications. 2. Consulting relevant quality management standards, regulatory requirements, and internal procedures. 3. Conducting a thorough risk assessment, quantifying potential impacts where possible. 4. Engaging in open and honest communication with all stakeholders, presenting data and findings objectively. 5. Documenting all decisions and the rationale behind them. 6. Escalating concerns through appropriate channels if a proposed action is deemed to compromise product reliability or regulatory compliance. Question 11. The monitoring system demonstrates a trend of intermittent failures under combined thermal and vibration stress during accelerated testing, suggesting potential design vulnerabilities. Which approach best optimizes the process for identifying and rectifying these issues while adhering to reliability engineering best practices? Option A. Increase the thermal and vibration stress levels significantly in subsequent halt cycles to rapidly induce catastrophic failures and pinpoint the weakest components. Option B. Document the intermittent failures as acceptable operational anomalies within the accelerated testing parameters and proceed with product release after a minimal number of halt cycles. Option C. Conduct a detailed failure mode and effects analysis (FME) on the observed intermittent failures. Use HALT to systematically explore the identified failure modes at controlled stress levels and implement design changes based on root cause analysis before proceeding to HAS for manufacturing defect screening. Option D. Immediately transition to HAS with slightly elevated stress levels to screen out units exhibiting similar intermittent failures, assuming they are primarily manufacturing related. The correct answer is A. Increase the thermal and vibration stress levels significantly in subsequent halt cycles to rapidly induce catastrophic failures and pinpoint the weakest components. Explanation. This scenario presents a professional challenge because it requires balancing the need for rapid product improvement through aggressive testing with the ethical and regulatory imperative to ensure product safety and reliability before market release. The certified reliability engineer must navigate the potential for accelerated degradation during halt/HAS to identify design weaknesses without compromising the integrity of the product for its intended use or creating an undue risk to consumers. The decision-making process must be grounded in established reliability engineering principles and, where applicable, regulatory guidance relevant to the product's domain. The correct approach involves a systematic and data-driven implementation of HALT and HAS, focusing on identifying failure modes and their root causes. This approach aligns with the principles of robust design and continuous improvement, which are central to reliability engineering. Specifically, it emphasizes using HALT to explore the operational and environmental limits of the product, to uncover latent design flaws, and using HAS to screen for manufacturing defects that could lead to premature failure in the field. This methodical process, when documented and validated, supports claims of product reliability and can satisfy regulatory expectations for due diligence in product development and quality assurance. The professional engineer must ensure that the stress levels and durations used in HALT/HAS are carefully controlled, and that the data collected is used to implement corrective actions that enhance, rather than degrade, the product's long-term reliability. An incorrect approach of solely increasing stress levels in HALT without a clear understanding of failure mechanisms, or without implementing corrective actions based on findings, would be professionally unacceptable. This could lead to premature product failure, customer dissatisfaction, and potential safety hazards, violating the engineer's duty to protect public welfare and uphold professional standards. Furthermore, releasing a product that has undergone aggressive screening without verifying the effectiveness of corrective actions, or without understanding the impact of the screening on product life, would be a significant ethical and potentially regulatory failure, as it bypasses the intended purpose of reliability testing. Another incorrect approach would be to use HAS as a substitute for fundamental design improvements identified during HALT. HAS is a screening tool for manufacturing issues, not a method to fix design flaws. Relying on HAS to catch design-related failures would be a misapplication of the technique and would fail to address the root causes of unreliability, leading to ongoing product issues and potential regulatory scrutiny. The professional decision-making process for similar situations should involve a thorough risk assessment, a clear understanding of the product's intended use and operating environment, and adherence to established reliability engineering methodologies. Engineers should prioritize understanding failure modes and mechanisms over simply applying higher stress. They must maintain meticulous records of test conditions, observed failures, and implemented corrective actions. When in doubt, consulting with subject matter experts, reviewing industry best practices, and seeking guidance from relevant regulatory bodies, if applicable to the product's domain, are crucial steps in ensuring responsible and effective application of HALT and HAS. Question 12. Quality control measures reveal an increasing trend in early-life failures for a critical component in a newly launched product. As a certified reliability engineer, which of the following approaches would be most appropriate for assessing the situation and guiding corrective actions, adhering strictly to the principles of risk assessment and the Weibull analysis framework for parameter estimation? Option A. Attribute the observed increase in early failures to random statistical variation and continue monitoring the product without further investigation, as the sample size is still relatively small. Option B. Calculate simple average failure rates and standard deviations from the data, and use these descriptive statistics to justify a minor adjustment to the warranty period. Option C. Apply Weibull analysis to the collected failure data to estimate the shape and scale parameters, then use these parameters to characterize the failure distribution and inform a risk-based strategy for addressing potential reliability issues. Option D. Immediately halt production and initiate a complete redesign of the component based on the initial observation of increased early failures, without further statistical analysis. The correct answer is C. Apply Weibull analysis to the collected failure data to estimate the shape and scale parameters, then use these parameters to characterize the failure distribution and inform a risk-based strategy for addressing potential reliability issues. Explanation. This scenario presents a professional challenge because the reliability engineer must interpret and act upon data that suggests a potential deviation from expected product performance, impacting customer satisfaction, warranty costs, and regulatory compliance. The challenge lies in selecting the most appropriate method for analyzing the failure data to inform corrective actions, balancing the need for timely intervention with the accuracy of the analysis. The engineer must consider the implications of different analytical approaches on decision-making and resource allocation. The correct approach involves using Weibull analysis to estimate the shape and scale parameters of the failure distribution, which then informs the assessment of failure modes and the development of a risk-based strategy for reliability improvement. This is professionally sound because Weibull analysis is a widely accepted statistical tool for modeling time-to-failure data, particularly for systems with wear-out or infant mortality phases. Regulatory frameworks often implicitly or explicitly encourage data-driven approaches to product reliability and safety. By estimating these parameters, the engineer can quantify the rate of failure and identify potential acceleration of failures, allowing for proactive risk mitigation. This aligns with ethical obligations to ensure product safety and performance and regulatory expectations for robust quality management systems. An incorrect approach would be to dismiss the observed increase in early failures without a thorough statistical analysis, assuming it is within acceptable statistical noise. This is professionally unacceptable because it ignores potentially critical information about product defects or design flaws, leading to a failure to address root causes. Ethically, this could result in continued delivery of substandard products, potentially harming customers and the company's reputation. Regulatory frameworks often mandate investigation of significant deviations from expected performance. Another incorrect approach would be to immediately implement costly design changes based on anecdotal evidence or preliminary, unvalidated data. This is professionally unsound as it can lead to unnecessary expenditure, potential introduction of new failure modes, and disruption of production without a clear understanding of the problem's scope or root cause. It demonstrates a lack of rigorous data analysis and a failure to follow a systematic risk assessment process, which is often a requirement in regulated industries. A further incorrect approach would be to rely solely on descriptive statistics without employing a distribution fitting technique like Weibull analysis. While descriptive statistics can summarize data, they do not provide the predictive power or the ability to extrapolate failure trends that Weibull parameters offer. This limits the engineer's ability to forecast future failures, assess the effectiveness of potential interventions, or understand the underlying failure mechanisms, thereby failing to meet the depth of analysis expected for robust reliability engineering and potentially contravening regulatory expectations for comprehensive failure analysis. A professional decision-making process for similar situations should involve 1. Data collection and validation. Ensure the failure data is accurate, complete, and representative. 2. Preliminary analysis. Conduct initial descriptive statistics to understand the data's characteristics. 3. Appropriate statistical modeling. Select and apply suitable statistical techniques, such as Weibull analysis, to model the failure distribution and estimate key parameters. 4. Root cause analysis. Investigate the identified failure patterns to determine underlying causes. 5. Risk assessment. Quantify the risks associated with the observed failure rates and potential future failures. 6. Action planning. Develop and implement data-driven corrective and preventive actions. 7. Monitoring and review. Continuously monitor product reliability and the effectiveness of implemented actions. Question 13. The audit findings indicate a pattern of recurring nonconformances in critical manufacturing processes, suggesting systemic weaknesses rather than isolated incidents. Considering the principles of Deming, Jurin, and Crosby, which quality philosophy best guides the strategic response to prevent future occurrences and foster a culture of continuous improvement? Option A. Adopting a Deming-inspired approach focused on understanding and improving the entire system, emphasizing management's role in driving change and statistical process control. Option B. Focusing solely on immediate corrective actions for each identified nonconformance to quickly resolve the reported issues. Option C. Utilizing a Jurin-inspired approach that prioritizes project-by-project improvement efforts targeting specific quality problems, with a focus on the quality trilogy of planning, control, and improvement. Option D. Implementing a Crosby-style approach that focuses on doing it right the first time through clear standards and employee training, with an emphasis on zero defects as a motivational goal. The correct answer is A. Adopting a Deming-inspired approach focused on understanding and improving the entire system, emphasizing management's role in driving change and statistical process control. Explanation. This scenario is professionally challenging because it requires a reliability engineer to interpret audit findings through the lens of established quality philosophies and then select the most appropriate strategic response. The challenge lies in moving beyond a purely technical assessment of the findings to a strategic decision that aligns with a recognized quality management framework, ensuring long-term systemic improvement rather than just addressing immediate symptoms. Careful judgment is required to discern which quality philosophy's core tenets best address the root causes identified by the audit and align with the organization's commitment to continuous improvement, as often mandated by quality standards like ISO 9001, which underpin many reliability engineering practices. The correct approach involves adopting a philosophy that emphasizes the interconnectedness of processes and the importance of management commitment to driving quality. This aligns with Deming's philosophy, which stresses the need for a system-wide approach to quality improvement, focusing on understanding and improving the entire system, not just individual components or products. Deming's 14 points, for instance, advocate for leadership commitment, breaking down barriers, and continuous improvement through a plan-do-check-act cycle. This approach is ethically sound and professionally responsible, as it seeks to prevent future failures by addressing systemic issues, thereby protecting customers and stakeholders from recurring defects and ensuring the organization's long-term viability and reputation. Regulatory frameworks, particularly those related to product safety and quality management systems, e.g., ISO 9001, implicitly or explicitly encourage such holistic, preventative approaches. An incorrect approach would be to solely focus on immediate corrective actions without considering the underlying systemic causes. This might involve implementing a quick fix for the identified issues, which is characteristic of a less strategic, more reactive stance. This fails to address the deeper organizational or process-related flaws that allowed the issues to arise in the first place. Ethically, this approach is deficient because it risks recurrence of problems, potentially leading to continued customer dissatisfaction or even safety concerns, and it does not demonstrate a commitment to the robust quality management principles expected in regulated industries. Another incorrect approach would be to adopt a philosophy that places the primary burden of quality solely on the workforce, without sufficient emphasis on management's role in creating the environment for quality. While employee involvement is crucial, a philosophy that neglects management's responsibility for system design, resource allocation, and strategic direction would be incomplete. This approach fails to leverage the full potential of quality management principles, which require leadership to champion and facilitate quality initiatives, can lead to a perception of blame rather than a collaborative effort for improvement, which is contrary to the spirit of most quality standards and ethical business practices. The professional reasoning process for similar situations should involve 1. Understanding the audit findings thoroughly, identifying the nature and potential impact of the issues. 2. Evaluating the findings against the core principles of recognized quality philosophies, Deming, Jurin, Crosby, etc. 3. Determining which philosophy's framework best addresses the systemic root causes indicated by the audit. 4. Considering the organization's existing quality culture, resources, and strategic objectives. 5. Selecting the approach that promotes sustainable, long-term improvement and aligns with ethical responsibilities and regulatory expectations for quality management. Question 14. Benchmark analysis indicates that for a critical component in a new aerospace system, the estimated mean time between failures, MTBF, derived from accelerated life testing is 500 hours. Given the regulatory requirement for robust reliability assurance, which of the following approach is best, reflects the professional and compliant method for presenting this reliability information to the certification authority. Option A. Report only the upper bound of the MTBF, assuming a conservative estimate of 2,000 hours to ensure a favorable impression. Option B. Provide a range of possible MTBF values from 1,000 to 2,000 hours based on engineering judgment of potential test variations. Option C. Present the MTBF as a single point estimate of 500 hours, as this is the direct result of the testing. Option D. Construct and present a 95% confidence interval for the MTBF, acknowledging the statistical uncertainty inherent in the test data. The correct answer is C. Present the MTBF as a single point estimate of 500 hours, as this is the direct result of the testing. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting and applying reliability data within the context of regulatory compliance for a critical engineering project. The challenge lies in moving beyond simple point estimates of reliability to understanding the inherent uncertainty associated with these estimates, as mandated by regulatory frameworks that emphasize robust risk assessment and assurance. The need for confidence interval arises because a single reliability number derived from limited testing or historical data is insufficient for making critical design, maintenance, or operational decisions. Professionals must demonstrate that their reliability claims are supported by a range of plausible values, reflecting the statistical variability and potential for error in the data. This requires a nuanced understanding of statistical inference and its practical implications for safety and performance. Correct approach analysis. The correct approach involves constructing and interpreting a confidence interval for the reliability metric. This is the professionally sound and regulatorily compliant method because it acknowledges and quantifies the uncertainty inherent in estimating reliability from sample data. A confidence interval provides a range of values within which the true reliability is likely to lie, with a specified level of confidence. This aligns with the certified reliability engineer's responsibility to provide data-driven insights that account for statistical variation, enabling informed decision-making regarding risk and assurance. Regulatory bodies often require evidence of this statistical rigor to ensure that reliability claims are not overly optimistic and that potential failures are adequately considered. For instance, in the U.S., frameworks like those from the FDA for medical devices or the FAA for aviation components implicitly or explicitly demand an understanding of uncertainty in reliability predictions to ensure public safety. Incorrect approaches analysis. Using only the point estimate of reliability without considering its uncertainty is an incorrect approach. This fails to meet regulatory expectations for a comprehensive assessment of reliability. Presents a single, potentially misleading figure that does not reflect the statistical limitations of the data, leading to an overestimation of certainty and potentially inadequate risk mitigation strategies. This can be seen as a failure to adhere to principles of sound engineering judgment and due diligence, which are often implicitly or explicitly required by regulatory oversight. Presenting a range of reliability values without a defined confidence level or a clear statistical basis is also an incorrect approach. While it acknowledges variability, it lacks the scientific rigor and statistical foundation required for regulatory acceptance. Without a specified confidence level, the range is arbitrary and does not provide a quantifiable measure of assurance, making it difficult for stakeholders or regulators to assess the reliability claims. Focusing solely on the upper bound of a reliability estimate without considering the lower bound or the confidence interval's width is another incorrect approach. While the upper bound might seem conservative, it ignores the potential for the true reliability to be lower, which could lead to underestimation of risk and insufficient safety margins. A complete confidence interval provides a balanced view of the plausible range of reliability. Professional reasoning. Professionals should approach reliability assessment by first identifying the relevant reliability metric and the available data. They must then determine the appropriate statistical method for estimating this metric and its associated uncertainty. This involves selecting a confidence level that balances the need for precision with the practical limitations of data availability and the criticality of the system. Interpretation of the confidence interval should then be integrated into the risk assessment and decision-making process, ensuring that all plausible reliability scenarios are considered. When communicating findings, it is crucial to clearly articulate the confidence interval and its implications, rather than presenting a single point estimate. This systematic approach ensures that reliability claims are robust, transparent, and compliant with regulatory expectations. Question 15. Process analysis reveals that a critical manufacturing process has been operating for 6 months, consistently producing parts within the specified tolerance limits based on recent sample data. The engineering team is debating whether to focus on the short-term capability indices, CP, CPK, or the long-term capability indices, PP, PPK, to assess the process's ongoing reliability and predict future performance. Which approach best aligns with the certified reliability engineer's responsibility to ensure consistent product quality and process stability over time. Option A. Focus solely on the short-term process capability indices, CP, CPK, because they represent the ideal capability of the process when it is operating under stable conditions, which is what the recent sample data suggests. Option B. Focus on the long-term process capability indices, PP, PPK, as they account for the total variation experienced by the process over its operational history, providing a more realistic assessment of its ability to meet specifications consistently. Option C. Use a weighted average of short-term and long-term indices to provide a balanced view, as neither metric alone can fully capture the process's performance. Option D. Prioritize the average output of the process and disregard process capability analysis, as long as the current production meets the immediate customer requirements. Correct answer is B. Focus on the long-term process capability indices PP, PPK, as they account for the total variation experienced by the process over its operational history, providing a more realistic assessment of its ability to meet specifications consistently. Explanation. This scenario presents a professional challenge because it requires an engineer to interpret process capability data and make a decision that impacts product quality, customer satisfaction, and potentially regulatory compliance. The challenge lies in understanding the nuances between short-term and long-term process performance and their implications for ongoing production. Careful judgment is required to select the most appropriate metric for assessing the process's ability to meet specifications consistently over time, especially when considering the certified reliability engineer's responsibility for ensuring product reliability and adherence to standards. The correct approach involves utilizing long-term process capability indices, PP and PPK, when assessing the overall performance of a process that has been operating for an extended period and is expected to continue doing so. This is because PP and PPK account for the total variation in the process, including both within subgroup and between subgroup variation, over the entire production run. For a certified reliability engineer, this aligns with the ethical responsibility to ensure that products consistently meet their intended specifications and performance requirements throughout their life cycle, as mandated by general principles of professional engineering practice and the implied commitment to quality inherent in the CRE designation. Regulatory frameworks, while not explicitly detailed here, generally expect demonstrable control and predictability of manufacturing processes to ensure product safety and efficacy. An incorrect approach would be to solely rely on short-term process capability indices, CP and CPK, for a process that has been running for a significant duration and is expected to continue. This is because CP and CPK only consider the within-subgroup variation and do not capture the impact of shifts or drifts in the process mean over time. Ethically, this could lead to a false sense of security, potentially masking underlying process instability that could result in out-of-specification products. This failure to consider total variation is a direct contravention of the professional duty to ensure robust and reliable processes. Another incorrect approach would be to ignore process capability analysis altogether and focus only on the average output of the process. This is a significant ethical and professional failure. Process capability analysis provides crucial information about the variability of the process relative to its specification limits. Without this analysis, an engineer cannot determine if the process is inherently capable of meeting requirements, regardless of its average performance. This oversight could lead to the acceptance of a process that, while currently producing acceptable parts on average, has a high probability of producing non-conforming parts in the future due to excessive variation. This directly undermines the core principles of reliability engineering and the commitment to producing dependable products. The professional decision-making process for similar situations should involve a systematic evaluation of the data, considering the context of the process's operational history and future expectations. First, understand the purpose of the analysis. Is it for initial process setup, ongoing monitoring, or problem solving? Second, identify the relevant metrics CP, CPK, PP, PPK, and understand what each measures. Third, consider the time frame and the type of variation present. For established processes with ongoing production, long-term indices are generally more appropriate for assessing overall capability. Finally, make a decision based on the comprehensive understanding of the process's performance relative to specifications, ensuring that the chosen metric accurately reflects the potential for reliable and consistent output, thereby upholding professional and ethical obligations. Question 16. Operational review demonstrates a recurring pattern of minor equipment malfunctions leading to unscheduled downtime. A Kaizen event is proposed to address this, which approach best aligns with the principles of continuous improvement and risk management for a certified reliability engineer. Option A. Implement a Kaizen event to address the symptoms of the malfunctions, such as improving maintenance response times, without investigating the underlying causes of the equipment failures. Option B. Initiate a Kaizen event after a comprehensive risk assessment has been performed to identify the root causes and potential severity of the equipment malfunctions, with the Kaizen objectives directly derived from these findings. Option C. Conduct a Kaizen event focused on identifying and implementing immediate, practical solutions to the observed malfunctions, based on operator feedback and historical downtime logs. Option D. Organize a Kaizen event to brainstorm general ideas for improving equipment reliability, without a specific focus on the recent downtime incidents. The correct answer is C. Conduct a Kaizen event focused on identifying and implementing immediate, practical solutions to the observed malfunctions, based on operator feedback and historical downtime logs. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for operational efficiency with the long-term commitment to a culture of continuous improvement, as mandated by robust quality management systems often referenced in reliability engineering certifications. The challenge lies in identifying the most effective approach to leverage a continuous improvement initiative, Kaizen, to address identified risks, ensuring that the chosen method aligns with established best practices and regulatory expectations for risk management and process enhancement. Careful judgment is required to select an approach that is not only expedient, but also sustainable and demonstrably effective in mitigating future risks. The correct approach involves a structured risk assessment that directly informs the Kaizen event's objectives and scope. This method is correct because it ensures that the continuous improvement efforts are targeted at the most critical areas identified through risk analysis, thereby maximizing their impact on reliability and safety. Regulatory frameworks and industry best practices for quality and risk management emphasize a data-driven, proactive approach to identifying and mitigating potential failures. By linking Kaizen directly to risk assessment findings, organizations demonstrate a commitment to systematic improvement and adherence to principles of due diligence, which are often implicit or explicit requirements in professional engineering standards and certifications. This approach ensures that resources are allocated efficiently to address the most significant threats to operational reliability. An incorrect approach would be to initiate a Kaizen event without a clear, risk-informed objective. This is professionally unacceptable because it risks diluting the impact of the improvement effort, potentially addressing superficial issues rather than root causes of significant risks. It fails to demonstrate a systematic and data-driven approach to risk management, which is a cornerstone of professional engineering practice and often a requirement for compliance with quality standards. Such an approach could lead to wasted resources and a failure to achieve meaningful improvements in reliability, potentially exposing the organization to continued or even increased risks. Another incorrect approach is to focus solely on implementing a Kaizen event based on anecdotal evidence or perceived problems without a formal risk assessment. This is ethically and professionally problematic, as it bypasses the structured analysis necessary to objectively identify and prioritize risks. It can lead to misallocation of resources, addressing symptoms rather than root causes, and a lack of demonstrable progress in mitigating significant operational risks. Professional engineering ethics and quality management principles demand a rigorous, evidence-based approach to problem-solving and improvement. A third incorrect approach involves treating the Kaizen event as a standalone initiative, disconnected from the broader risk management framework. This is professionally unsound because it fails to integrate continuous improvement into the organization's overall strategy for managing operational risks. Without this integration, Kaizen efforts may become isolated projects with limited long-term impact, failing to contribute to a sustained culture of reliability and risk reduction. Professional decision-making in this context requires a holistic view, ensuring that all improvement initiatives are aligned with and contribute to the organization's overarching risk management objectives. The professional decision-making process for similar situations should involve 1. Understanding the overarching objectives of the Certified Reliability Engineer certification, which includes promoting reliability through systematic processes and risk mitigation. 2. Recognizing the importance of a structured risk assessment as the foundation for any targeted improvement initiative. 3. Evaluating potential Kaizen approaches based on their alignment with identified risks and their potential for sustainable impact. 4. Prioritizing approaches that demonstrate a clear link between risk mitigation and improvement objectives, ensuring compliance with professional standards and regulatory expectations for quality and safety. Question 17. Strategic planning requires a thorough assessment of an organization's quality cost structure. A new product development team is debating the allocation of resources, with some advocating for significant investment in advanced inspection technologies, appraisal, and robust training programs for manufacturing personnel, prevention, while others propose deferring these investments to focus on market entry speed, assuming that any defects can be addressed through warranty claims and rework failure, which approach best aligns with the principles of effective quality cost management and the professional responsibilities of a certified reliability engineer. Option A. Prioritize investment in prevention and appraisal activities to proactively identify and mitigate potential defects, thereby minimizing future failure costs and ensuring product reliability. Option B. Defer all significant investments in prevention and appraisal until after the product has achieved substantial market share and profitability, then address quality issues as they arise. Option C. Focus resources on rapid market entry and rely on post-sale warranty and rework to address any product failures, as this minimizes upfront investment. Option D. Allocate the majority of resources to appraisal activities, such as extensive end-of-line testing, while minimizing investment in prevention and proactive defect avoidance. The correct answer is A. Prioritize investment in prevention and appraisal activities to proactively identify and mitigate potential defects, thereby minimizing future failure costs and ensuring product reliability. Explanation. This scenario presents a common implementation challenge in quality management, balancing the perceived immediate costs of prevention and appraisal activities against the potential for significant future failure costs. The challenge lies in convincing stakeholders, who may be focused on short-term financial performance, to invest in proactive quality measures. The certified reliability engineer's role is to demonstrate the long-term value and regulatory imperative of a robust quality cost system. The correct approach involves a comprehensive understanding and application of quality cost principles, recognizing that investing in prevention and appraisal activities is not merely an expense, but a strategic investment that mitigates higher failure costs and aligns with regulatory expectations for product safety and reliability. This approach is justified by the fundamental principles of quality management and the implicit regulatory requirement to produce safe and reliable products, which inherently involves managing quality costs effectively. While specific regulations for the Certified Reliability Engineer exam are not explicitly stated as a particular jurisdiction, e.g., U.S., UK, the principles of quality cost management are universally recognized in engineering practice and are often embedded within broader quality management standards, like ISO 9001, which has global applicability and industry-specific regulations that mandate product safety and performance. A proactive stance on quality costs demonstrates a commitment to these overarching principles. An incorrect approach that focuses solely on minimizing appraisal costs without adequate prevention measures would be professionally unsound. This failure stems from a misunderstanding of quality cost dynamics, where reducing appraisal might lead to undetected defects, escalating failure costs, both internal and external, and potential regulatory noncompliance due to product failures. Similarly, an approach that neglects prevention and appraisal entirely, assuming failure costs will be managed reactively, is ethically and professionally deficient. This ignores the significant financial and reputational damage associated with product failures, as well as the potential for harm to end users, which is a core concern in any engineering discipline governed by safety and reliability standards. Furthermore, such an approach would likely violate the spirit, if not the letter, of regulations that require due diligence in product design, manufacturing, and quality assurance. A professional decision-making process for similar situations should involve 1. Educating stakeholders on the interconnectedness of prevention, appraisal, and failure costs, using data-driven arguments to illustrate the return on investment for proactive measures. 2. Developing a balanced quality cost strategy that allocates resources appropriately across all three categories, prioritizing prevention and appraisal to minimize failure costs. 3. Continuously monitoring and analyzing quality cost data to identify trends and opportunities for improvement. 4. advocating for a quality culture that views quality as a value driver, not just a cost center, aligning with the ethical responsibility to deliver reliable and safe products. Question 18. The risk matrix shows that a specific component failure mode has a high probability and a severe consequence, while the current reliability metrics indicate a moderate MTBF and a high MTTR for this component. Considering the regulatory framework for critical infrastructure reliability, which of the following actions best addresses the identified risk? Option A. Conduct a detailed root cause analysis of all component failures to identify minor improvements across the board, prioritizing cost-effectiveness over specific high-risk scenarios. Option B. Implement a comprehensive maintenance program focused on reducing the MTTR for this component, alongside targeted design improvements to address the root causes of its failure modes. Option C. Focus solely on achieving a predetermined system availability target by adjusting maintenance schedules, irrespective of specific component failure modes. Option D. Initiate a project to significantly increase the MTBF of the component through material upgrades, without immediate focus on repair times. Correct answer is B. Implement a comprehensive maintenance program focused on reducing the MTTR for this component, alongside targeted design improvements to address the root causes of its failure modes. Explanation. This scenario presents a professional challenge because it requires an engineer to interpret reliability metrics within the context of regulatory compliance and operational risk, rather than purely technical performance. The pressure to meet production targets can create a conflict with the imperative to maintain a safe and reliable system, especially when reliability metrics indicate potential issues. Careful judgment is required to balance these competing demands, ensuring that decisions are grounded in data and adhere to established standards. The correct approach involves prioritizing the mitigation of identified risks based on the severity indicated by the risk matrix, using the reliability metrics as supporting evidence for the potential impact of failures. This aligns with the fundamental principles of reliability engineering, which emphasize proactive risk management and the prevention of failures to ensure system integrity and safety. Regulatory frameworks for critical systems often mandate such a risk-based approach, requiring engineers to demonstrate that potential hazards have been adequately addressed. By focusing on the highest risk areas, the engineer ensures that resources are allocated effectively to address the most critical vulnerabilities, thereby upholding professional responsibility and regulatory compliance. An approach that focuses solely on improving MTBF without considering the associated risk or the impact on other metrics like MTTR or availability is incorrect. While a higher MTBF is generally desirable, it does not guarantee operational readiness or safety if failures are difficult or time-consuming to repair, or if the system is not available when needed. This oversight can lead to regulatory noncompliance if the chosen improvement strategy does not adequately address the risks identified in the risk matrix. Another incorrect approach is to prioritize reducing MTTR without a comprehensive understanding of the underlying failure modes or their associated risks. While quick repairs are beneficial, if the root causes of failures are not addressed, the system may experience frequent failures, leading to unacceptable downtime and potentially unsafe conditions, even if each individual repair is fast. This can result in a failure to meet regulatory requirements for system reliability and availability. Focusing solely on achieving a target availability figure without considering the specific failure modes and their associated risks is also an inadequate approach. Availability is a composite metric, and a high availability figure can be achieved through various combinations of MTBF and MTTR. Without understanding the risk profile of the failures contributing to unavailability, the chosen mitigation strategies might not address the most critical threats, potentially leading to regulatory non-compliance and operational hazards. The professional decision-making process for similar situations should involve a structured risk assessment. First, thoroughly understand the operational context and the regulatory requirements applicable to the system. Second, analyze the reliability metrics in conjunction with the risk matrix to identify areas where potential failures pose the greatest risk. Third, develop and evaluate mitigation strategies that directly address these high-risk failure modes, considering the impact on all relevant reliability metrics and overall system availability. Finally, document the decision-making process, the chosen strategies, and the expected outcomes, ensuring transparency and accountability. Question 19. Quality control measures reveal that in daily production batches of 100 units, the number of non-conforming items is being recorded. The quality team is considering which statistical process control, SPC, chart to implement to monitor this data. They want to understand the stability of the process in terms of the proportion of defective units produced. Which SPC chart is the most appropriate for this situation and why? Option A, a C chart because it monitors the number of nonconformities per unit. Option B, an R chart because it monitors the range of measurements in samples. Option C, a P chart because it monitors the proportion of nonconforming items in samples of constant size. Option D, an X bar chart because it monitors the average of measurements in samples. The correct answer is C, a P chart, because it monitors the proportion of nonconforming items in samples of constant size. Explanation: this scenario is professionally challenging because it requires a reliability engineer to interpret statistical data from production processes and make informed decisions about process stability and product quality, directly impacting customer satisfaction and regulatory compliance. The challenge lies in selecting the most appropriate statistical process control, SPC, chart for the given data type, and understanding the implications of out-of-control signals within the context of established quality management systems, which are often guided by regulatory frameworks like ISO 9001 or specific industry standards. The correct approach involves selecting an SPC chart that accurately reflects the nature of the data being collected and the specific quality characteristic being monitored. For attribute data that counts the number of nonconforming units in a sample of constant size, a P chart is the appropriate tool. This chart monitors the proportion of nonconforming items, providing a clear visual representation of process stability over time. Its use is justified by its ability to detect shifts in the overall defect rate, which is crucial for maintaining consistent product quality and meeting customer specifications, thereby aligning with the principles of continuous improvement and defect prevention mandated by quality management standards. An incorrect approach would be to use an X-bar chart for this scenario. An X-bar chart is designed for variable data, specifically the average of measurements from a sample. Using it for attribute data, counting nonconformities, would lead to a misinterpretation of process variation and potentially incorrect conclusions about process stability, failing to accurately identify the root causes of defects and thus violating the principle of data-driven decision-making inherent in quality management. Another incorrect approach would be to use an R chart. Similar to the X-bar chart, the R chart is used for variable data, specifically monitoring the range of measurements within a sample. Applying it to attribute data would be fundamentally flawed, as it does not measure the dispersion of nonconformities in a meaningful way for this data type. This would result in an inability to effectively control the process and a failure to meet quality objectives. A third incorrect approach would be to use a C chart. While a C chart is used for attribute data, it is specifically designed for counting the number of nonconformities per unit when the sample size is constant. In this scenario, the data is presented as the number of nonconforming units in a sample of a fixed size, not the number of defects per unit. Using a C chart would misrepresent the data and lead to an inaccurate assessment of process performance, undermining the reliability of the quality control system. The professional decision-making process for similar situations should involve a systematic evaluation of the data type, variable vs. Attribute, the quality characteristic being measured, count of nonconforming units, number of defects, measurement value, and the objective of the control chart, monitoring averages, variation, proportions, or counts. This systematic approach ensures that the chosen SPC tool is appropriate for the task, leading to accurate process monitoring, effective problem identification, and ultimately, the maintenance of product reliability and compliance with quality standards. Question 20. The audit findings indicate that the reliability engineering team has consistently used the exponential distribution to model the lifetime of all electronic components, including those known to exhibit wear-out characteristics and those with potential for early-life failures. The team's justification for this practice is that it is the simplest distribution to implement and provides a conservative estimate of mean time between failures, MTBF. Which of the following approaches best addresses the audit findings and ensures adherence to professional reliability engineering standards? Option A. Request additional training for the team on the exponential distribution to reinforce its proper application and limitations, and to ensure consistent implementation. Option B. Continue using the exponential distribution for all components, as it is the simplest to implement and provides a conservative MTBF estimate, which is acceptable for initial design phases. Option C. Immediately switch to the Weibull distribution for all components, as it is known to be more flexible than the exponential distribution and can accommodate various failure modes. Option D. Conduct a comprehensive review of the failure data for each component type, considering the underlying physics of failure. Select the most appropriate statistical distribution, e.g., Weibull, log normal, normal, based on goodness of fit tests and physical plausibility, and document the rationale for each selection. The correct answer is D. Conduct a comprehensive review of the failure data for each component type, considering the underlying physics of failure. Select the most appropriate statistical distribution, e.g., Weibull, log normal, normal, based on goodness of fit tests and physical plausibility, and document the rationale for each selection. Explanation. The audit findings indicate a potential gap in the reliability engineering team's understanding and application of statistical distributions, specifically concerning the selection and justification of models for component lifetime prediction. This scenario is professionally challenging because an incorrect choice of distribution can lead to inaccurate reliability predictions, impacting product design, maintenance schedules, warranty costs, and ultimately, customer safety and satisfaction. Certified Reliability Engineer (CRE) designation implies a commitment to applying established engineering principles and ethical standards, which includes the rigorous and justifiable selection of analytical tools. The correct approach involves a thorough evaluation of the failure data and the underlying physics of failure to select the most appropriate statistical distribution. This requires understanding the characteristics of each distribution, exponential, Weibull, normal, log normal, and how they relate to different failure modes. For instance, the exponential distribution is suitable for constant failure rates, random failures, while the Weibull distribution is more versatile and can model infant mortality, constant or wear-out failures. The normal and log-normal distributions are often used for wear-out failures where a specific mean and variance are observed. Justification for the chosen distribution should be based on goodness of fit tests, physical plausibility, and alignment with industry, best practices, and relevant standards, e.g., those referenced by ASQ or other recognized bodies for reliability engineering. This aligns with the CRE's ethical obligation to perform work competently and to the best of their ability, ensuring that decisions are data-driven and technically sound. An incorrect approach would be to arbitrarily select a distribution based on familiarity or ease of use without proper justification. For example, defaulting to the exponential distribution for all components, regardless of their failure modes, would be a failure to apply due diligence. This overlooks the potential for infant mortality or wear-out failures, leading to an underestimation of risk or an overestimation of component lifespan. Similarly, choosing a distribution solely because it yields the most favorable reliability figures without empirical support would be a misrepresentation of data and a breach of professional integrity. Another incorrect approach would be to ignore the physics of failure, which provides crucial context for selecting a distribution. For example, if a component is known to degrade over time due to wear, using an exponential distribution that assumes a constant failure rate would be inappropriate and misleading. These failures violate the CRE's responsibility to uphold the integrity of the engineering profession and to ensure that reliability assessments are accurate and defensible. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the available failure data and the operational context. Second, consider the known or suspected failure mechanisms of the component. Third, evaluate the suitability of different statistical distributions based on their theoretical properties and their ability to model the observed data and failure physics. Fourth, employ statistical methods, e.g., probability plots, goodness of fit tests, to validate the chosen distribution. Finally, clearly document the selection process and the rationale behind the chosen distribution, ensuring transparency and defensibility.